I'm Morgan. I work at Bright Idea, helping out with marketing efforts and getting a chance to sync and talk with folks like you. It's been great. I'm really excited. So to kick it off, I guess go ahead and tell me who you are and what you currently do.
Yeah, sure. Thanks, Morgan. Pleasure for me to have a chance to have a conversation with you as well. I'm Mark Francis, Chief Product Officer at Electronic Caregiver. We're a privately held, innovative digital health technology and services company, really reimagining tech-enabled home care.
Great. So taking a look at your LinkedIn, your career spans emerging technologies from robotics and wearables to AI-powered healthcare solutions. What frameworks or processes have you found most effective in identifying high impact opportunities and ensuring successful product market fit in health tech?
Yeah. Let me answer that through two lenses. One is overall, set aside health tech just for products and innovation holistically. Two of the best frameworks that I've had the opportunity to get exposed to and learn in my career. One has been around the concept of design thinking. So really bringing into very fast iterative prototyping, development, testing with end users and consumers of the product to really make that a core part of the innovation and the product development process at the front end. One of the things I learned when I first went into tech was that often tech companies would develop tech in a vacuum and then bring a finished solution to the market and say, here it is, now use it with zero user input. So that needs to change and has changed, which is great. When I was at Intel, for example, I came on board, and when we were driving new ventures, we had a business stakeholder and a tech stakeholder. So one of the things I did with my teams, I added a user stakeholder. So all three individuals had an equal voice at the table as we were vetting opportunities and designing solutions. The second framework I really like is one we use at Amazon, and I've taken that with me here at Electronic Caregiver, and that's a concept of working backwards. And that is something that at Amazon was very bullish in terms of innovation. If you had an idea, you could present it and very easy to get funding and resources to pursue that. But every single innovation, whether it ends up being Amazon Web Services or a robotics play, started with what's called a working backwards by producing a press release. You had to put together a 1 or 2 page press release with some frequently asked questions to say, what is the value to the end consumer and the market of what I'm developing? Why should we do it? So we'd mock up a press release. Here's what the product is. Here's what it does. Here's the value. Here's some customer quotes. And then it really helps sharpen that customer obsession and what that value proposition is. So I found that to be extremely valuable, and it really focuses teams, all stakeholders, and then from that we can go back and figure out, well, how do we create it? So those are two universal frameworks I would use. My big flashing alarm or warning in health is that's all great, but in healthcare, I've seen so many folks come up with incredible, elegant, powerful solutions, but struggle in the marketplace because they're not understanding in healthcare who is the payer. And the economics in healthcare are so different than a traditional market that if you don't understand why a payer would use this, even frankly, if you had great clinical outcomes, if it's going to cost the system money, if it's going to disrupt workflows, if it's something that's going to be a net negative economic cost to the people you're selling it to, it's probably not going to get adopted until you're able to solve that payment issue and that economic issue for them.
Great, thank you. I like those frameworks are really good. So at Electronic Caregiver, you've been instrumental in integrating AI-driven insights using AWS technologies. What key lessons can other product leaders take away when deploying AI in regulated industries like healthcare?
Yeah, I think that some of some of the key takeaways I'd say are even independent of it being a regulated industry or not. It's really who is your end user and how can you superpower those end users? If it's a doctor, how do you enable a doctor to become a doctor? How do you let a teacher teach? That's really the power of AI. 6 months ago, when I would go into a doctor's office, and it's been this way for decades now, unfortunately, the doctor is a slave to the EHR, sitting at a computer in a corner. You're sitting on, in your uncomfortable gown on this paper sheets trying to have a conversation. There's very little human interaction. It's almost all just as you're talking, they're typing into a keyboard. AI is changing that. Ambient scribes in healthcare are incredible. They're enabling a doctor to pull up their stool next to you, have a conversation, do any type of evaluation, and really changes that doctor-patient relationship. I think that's a great example of what AI can do. Regardless of industry, you got to respect privacy. You have to respect security. You need to make sure that you're doing things properly. But AI has the ability to give end users superpowers, and that's what's really exciting. And that's what we at AWS we worked at creating something that they actually just pushed out on a blog called the Health Data Accelerator. And it was really about how do you take omni-channel sources of data, package it in a way that it's actionable and giving insights that otherwise would be difficult to obtain to, in this case, clinical professionals.
Great. So we recently just put out a survey, and we're doing some data analysis now, and it's all around hackathons. So our survey found that while 81.5% of companies that run hackathons at least once a year, only 29% of projects ever move beyond the event. Based on your experience with hackathons at AWS and elsewhere, what strategies can companies use to ensure hackathon projects don't just die on the whiteboard and sort of just the theoretical? How do people push it beyond that?
Yeah, that's an interesting statistic, and that's some interesting data. I guess the first thing I would ask is, what's the purpose of doing the hackathon? Because depending on that context, that might not be bad outcomes. I remember at Intel, a lot of what we did while I was part of an internal innovation group, we also throughout the company were doing hackathons and startup weekends and stuff like that to teach the rest of the team about innovation, rapid innovation, bringing in multiple stakeholders. So in that case, it was more the exercise and the training, the experience that actually felt something sticking that was the highest value for us. That being said, while I see the value in that education, I think if you're going to do it that way and that's the purpose, that you should frame that up front so people understand the context of it, because otherwise you have a misalignment of expectations. Probably the most powerful hackathon and successful one that I was involved in, and some lessons from that, was when I was at AWS working with the robotics team. One of our lead customers was NASA, and they had a mission to Mars coming up to land the rover. And obviously, they wanted to make sure that the rover was able to navigate the terrain where it was targeted to land. Well, you can't practice that except in a simulated environment. So what we did is we worked with our technology to help with NASA engineers to create a simulation of the part of Mars where they were landing. We then had a simulated model of the rover. And what we did is we did a public the open source hackathon to say, hey, look, the rover is designed to land at point A. Here are points where NASA wants to explore. We're going to do an open source challenge. We're going to give you all the tools, techniques, simulation engines, all of that for you to be able to track different ways to get there. You got to manage resources, battery, power, natural obstacles, stuff like that. Because last thing you can do is get it stranded, because then you're doomed because there's no one there to retrieve it. So we did that. And what we did is we announced a hackathon. We did 3 months of training up front. So we started by training. So we exposed folks to a bunch of different tools. We brought in AWS and NASA scientists. We walked through different simulations that they had already done in the past and they were planning to do. We had experts available weekly to answer questions. And with that lead up, then we went into the open hackathon part for the teams. And one of the rewards was that whoever won the hackathon, NASA was committed to run their mission up in Mars. So it was very compelling for folks to participate. We ended up having over 1,000 teams from across the world participate. We announced a winner at one of the big AWS events, Remars at that time. And it was just very, very compelling. And it turned out the upfront training and framing really helped galvanize teams and make it more purposeful. So it helped address that issue of not just hacking for the sake of hacking, but something that there was a purposeful outcome that you knew that if you were selected, you were going to be able to be the one that was featured. So that was pretty cool.
Definitely, yeah. And all the conversations I'm having, that's where a lot of companies are missing the mark. They're doing the event for the event, and team building versus, oh, we can actually take these ideas, fund them, and have some meaningful outcomes.
Yeah,
Yeah,
yeah, makes a big
yeah,
difference.
definitely. All right, you've been working and pioneering technologies from Intel's wearables to AWS spatial computing. What common barriers prevent emerging tech from achieving mainstream adoption? And how can product leaders mitigate these risks?
Yeah, I would say that's a great question. I think here it's a matter of knowing what you're building and knowing who you're building it for. So one of the things we would always do is try to identify a persona for who that end user is. So we go through a discovery phase, we might do some design thinking, we try to figure out what we want to build and for whom, and then when we figured out who that whom was, we develop a persona around that. So for example, at Intel with our wearable computing, we were looking at things and the mission of the venture I was leading was, you know, what's the future of tech if this no longer exists? Okay. And so we really try to remove the barriers because a lot of wearables at that time were tethered to the phone, which is nothing wrong with that. But we're just saying remove any limitations, remove your preconditions, what is possible. So we started to look very, very broadly, and we ended up coming up with, we think a wrist-worn wearable would be pretty cool. We think there's a lot of market opportunity there. There's already products in the market, but there wasn't anything that was really purpose-built for a female. Females were basically using black rubber clunky products for a man, and that was our version. A lot of that was because the technology hadn't emerged. That the woman's wrist is has more curvature than a male's wrist. It's smaller, so you're going to have to do a lot of tech innovation there. But what we did is we identified Erica as our persona. She was a fashionista, 28, living in San Francisco. She would buy jewelry. She'd have a cuff bracelet. So we said, we're going to create a cuff bracelet for Erica, but design trumps tech. So that was our mission. Even at Intel, design trumps tech. So as we were doing things, we made trade-offs, and Erica had a seat at the table in all of our meetings. And it's like, what would Erica do? How would Erica use this? So if it's something that was going to compromise design, we didn't do it. So for example, if you have a wearable product, how are you going to keep it charged? So you had to have a little area to be able to plug in a charging cable. What we ended up doing, we hid that into clasp. So you open the product, and in the clasp, that's where we inserted a charger. So when she was wearing it, there was no bumps or imperfections on the design. We also told our team that if it doesn't add value to Erica, we're not putting it in. So we had different teams that were working on some very, very innovative technology, and we were very clear. We vetted out and look at it, and at the end of the day, it's like, how does this help Erica use this product, interact with this product, or be delighted with this product? And if it didn't, we didn't include it. So those were a couple of things we did, and really understanding again who that user is and what's going to delight him or her. That's what we really use as a focusing function for the team. And I think that's, and if I look beyond that initiative and other ones, I think that's a pretty good lesson that other folks could pick up as well.
Great, thanks for sharing. Health tech innovation is often constrained by regulatory compliance. How do you balance bold innovation with regulatory hurdles while still maintaining speed and product development?
Yeah, I think that everybody needs to come to an understanding that health tech is not a place where you can move fast and break things. Because if you break things in health tech, people can die. So, the table stakes need to be that that's not okay. That doesn't mean you can't move fast, but you need to move fast in a measured way. I think unlike maybe what we've seen in rideshare and hospitality, where we've kind of run over regulations and the repercussions of that hit years later. I think in healthcare you can't really do that. You really need to understand what the regulations are and work within those regulations from the very get-go. I think it also is important to understand, again, going back to the payer side and the economics of it. How does that work? I think a lot of times folks build something health tech, it's pretty interesting, and there's no way to pay for it. So then they get stalled for 3 to 5 years waiting to get a CPT code through to be able to afford it. Had they been looking at that up front, then maybe they could have concurrently been working on that aspect of the product as well. So when the product's ready to launch, that payment is in place, or they have a definitive answer whether that payment's going to be in place or not to help them either pivot or move forward. So I think there, again, not compromising privacy, security, understanding HIPAA, understanding other appropriate regulations, whether it's in terms of class of device for FDA or whatever, it's critically important. And I think those folks who understand that, you might get into the market faster by ignoring that, but it's going to catch up with you later anyways. So at the net is it'll probably end up taking longer. So do you want to pay that extra time up front? So maybe the innovation takes another quarter or two, or do you want to get 2 years worth of thrash a couple years later, and then negative market blowback as well? I'd rather spend. Our approach has been to overinvest up front to do it right.
Yeah, that makes sense. Jumping back to hackathons, obviously they can be a very powerful innovation tool, but without the right structure, they often fail to generate lasting results. I just question, based on your experience, what are the key stages of a well-designed hackathon that maximizes the chances of real-world implementation?
I think if somebody looks at a hackathon as not just an occurrence, but more of a continuum of engagement with the participants, I think that helps. One of the things we would do at Intel when we would run some hackathons is we'd give everybody, we'd start by doing a briefing and a training on what's called the business model canvas. So it's a really nice one-page tool to really help frame up what's a business concept, what are the different channels, who are the different competitors, what to go to market, how do you pricing, and really get people thinking about that before the hackathon even starts. So we'd have people go through that framework. After my Amazon experience, we've now added kind of the press release as an upfront assignment as well. So we'd have folks get things framed up that way, go into a hackathon then. So we're not starting from ground zero. Folks are starting already having invested in what the concept is and what the opportunity is, go through the hackathon. But then what we do is leave maybe anywhere from 2 weeks to 2 months post hackathon for further refinement, iterations, answering questions. And then after that period of time, we'd get together to have kind of a final graduation presentation. And at that time, we would have folks do so instead of in front of either business unit stakeholders or finance stakeholders as well, whether those were internal or external finance stakeholders. When I was at Intel, we would do that with our business units, and we'd work with Intel Capital to bring them and other firms, particularly angel type firms, to the table as well, or early stage firms, to be able to look at some of these opportunities. The net result of that, Intel has a product called the RealSense camera that came from some of our early innovation efforts. Our wearable work came from that. And then there was a couple other things that ended up getting spun out as IoT opportunities that the inventor or the inventor teams said, hey, there's not room for me to do this at Intel, but this is pretty interesting, so let's go out and do it as a NewCo.
You've worked on using structured and unstructured data to create AI-powered healthcare insights. What are some best practices for using AI to drive personalization while maintaining privacy and trust with users?
Yeah, that's a key question. Probably the best that I've seen us do it in terms of the personalization side is in healthcare is what we're doing at Electronic Caregiver. The vision of Electronic Caregiver going back, the company's 15 years old, was really to say, how do we address the issue of adherence and compliance in healthcare? Because it doesn't matter what your health condition is. If you're not adherence to what your care plan is, your medications, whatever, you're going to struggle to really change, whether it's behavioral change, clinical change, whatever it might be. So then we did a lot of ethnographic research trying to figure out what was going on. And we found out that, you get into motivational issues, behavior management issues, stuff like that. And often if the family member, you end up trying to encourage someone to change, it ends up being seen as nagging or negative. If it's a clinician, there's more respect there, but it's very much of an episodic situation. So at ECG, we said we're going to develop a virtual caregiver called Addison, and Addison's going to be AI powered, so she's going to be super smart, on edge, and she's going to be your friend, companion, caregiver as part of your care journey. So that's what we decided to do. And as we started to bring Addison out and do user testing about it, they liked that she was empathetic but not judgmental. They liked that she was supportive. And again, if there was issues of non-compliance, it was more educational than scolding. So that we learned that. But the other thing we learned too is that people wanted to be able to personalize Addison. You don't develop, even though it was a voice-based interaction, similar to like an Alexa, you don't form a personal relationship with an Alexa, but you get value out of that. With Addison, we said, okay, we're going to have a caregiver, and you can pick the gender, you can pick the age, you can pick the ethnicity, you can pick the language, you can decorate the environment. We decided to use something that we call atmospheric mirroring, so that if Morgan is in San Francisco and it's dusk, Addison's environment will mimic your environment. So sun up, sun down, lights on, lights off, snowing, raining, whatever it might. And as we've done that, we've seen that that level of personalization has driven significant compliance and utilization of the product, and also an ability to be more honest with Addison than the individual is with other people as part of their care circle. It's been a fascinating almost anthropological exercise for sure.
That's interesting. Really interesting. All right. You have built products for both enterprise and consumers, so B2B and B2C health markets. What are the biggest strategic differences when developing for those different segments, and how can product teams navigate them effectively?
They are two very different types of markets to go after. For me, I think it's, if done properly, B2B is much easier. And the key there is if done properly. Often what I've seen is that you have a product or service, you have business customers using it, they'll give you some anecdotal feedback that they need feature A or B. And often teams just then charge down to deliver A and B. But A or B was never really defined. It was a kind of a potentially a one-off comment, or it might have been a really good comment, but it wasn't really vetted. So one of the things we've done is say, okay, let's have a structured process by which let's reserve engineering resources for customer feedback and customer needs. Absolutely prioritize that. But we need a vetted process by which we will evaluate this. Start with a simple form, give it to the BD team, customer account managers. They can begin that vetting process. Then we'll get stakeholders together to really come up with what are the requirements for this request, what's the business need and the business value that's going to be delivered, potentially some commitments related to that, and then also what are the acceptance criteria. Once we started doing that, we were able to 10x our development speed, because a lot of the back and forth that happened, unfortunately, after a lot of code was already written and then rewritten, went away, because we overinvested up front to be able to streamline and move fast once we moved into build, and then be able to move much faster with either iterations on that or other part of our product backlog. So that's great in B2B. B2C, it's more the Wild West. And there you're saying, hey, I think there's an opportunity here for a consumer. I'm going to build something, and it's not quite, field of dreams. I'll build it, they will come. We might hope that. But again, there, I think, again, the same thing. If you can, I'm a mentor for an NIH, National Institutes of Health Startup Challenge. And one of the things that we've learned through that process and we've started implementing is, before teams can start building anything, you have to talk to 100 customers. Identify who you think your customers, go talk to 100 of them, not 5 or 10 or 20, but talk to 100. If you talk to 100 customers, you'll have a pretty good idea of where there might be gaps and opportunities in the market, and use that before you start building. So I think any type of B2C opportunities, if you can vet out with customers ahead of time, it's going to be valuable.
Great. Makes sense. You've built and led diverse teams across major organizations. What key leadership principles have helped you foster innovation, collaboration, and execution in product?
Yeah, great question. To me, the power of, there's an old saying, if you want to go fast, go alone. If you want to go far, go together. I think that's so much the case when it comes to, innovation and invention. You might have that brilliant inventor that comes up with concepts, but translating that into a sustained product is often very, very different. The engineering building at Stanford, I think his name Terman Hall, from one of their engineering deans, and he said the most humbling thing for him was to learn how different it is to build a prototype and then build a product. And it takes a team to be able to do that. So as a leader of the team, I think your key is pull together a diverse set of stakeholders that are mission driven, want to go fast, and unleash them to To me, I see the work of the leader is create that vision, build a team together, gain alignment in terms of having a shared purpose in terms of what's being built, for whom, by when, and then really serve as a player coach. And then also really say, my job is to be able to do blocking and tackling and protect this team and let them go by managing stakeholder relationships, acquiring resources, engaging with potential go-to-market partners, and really see that's really the value of that leader is to marshal resources, run interference, and then help take steps to be able to catalyze market acceptance of what's being developed as well.
One more hackathon question. This is the final question. So going back to our research, I'll share a little more data and then ask the question. According to our research, only 28% of companies that run hackathons include a clear evaluation and resource allocation process. So pretty low, less than a third. And only 18% of respondents said that company innovation was the biggest benefit of hackathons. So there's a lot of other benefits that people saw. So based on that, based on your experience, what practical steps can organizations take to bridge the gap between hackathon success and real-world product development?
I think a key is, I think, twofold. One is I would kind of try to reframe things from hackathons to maybe accelerator or incubator. When I think of it, when I think of a hackathon, I think of something that's more singular or focused, and it's like an activity, for lack of a better term. When I think of an accelerator or incubator, it's more sustained and there's more of a commitment around it. I think if reframing things, I think that then also gives folks an opportunity to say, hey, this is not a one or done. There might be one and done as part of it, but this is a sustained effort that's going to have tools and techniques that you're going to be able to learn throughout the process. You're going to apply them. So it's going to be very much applied learning. You're going to pull together a cross-functional set of folks. You're going to learn how to work with cross-functional teams, which you might not do every day in your day-to-day job. But I think the key thing at the back end too is say there should be a process of being able to present out with the opportunity to move some things forward. And again, whether or not that's through internal teams and resources or through external teams or resources, then I think you get a lot more value of that. But when I was at Intel, I was one of the mentors with Intel Capital was doing an ed tech accelerator. So basically, you had a place, a location, kind of a combination of a Y Combinator model as well. Brought teams together. They were able to work there. Brought experts in to be able to provide information to them and training and resources. Had cross-functional set of mentors available that people could tap into as well. And I think that worked very, very nicely because folks saw that it was a sustained commitment in terms of what was being built and then gave them something, again, whether the company, while the company had the first right to do something with it, whether to bring it into a business unit or to invest, if the company chose not to, the team didn't necessarily have to disband. If there was something there that folks wanted to move forward, they would have an opportunity to do so. And I think that looking at things through maybe a wider aperture is valuable for organizations. I think the other thing in terms of innovation is the experience I had at Intel and the experience I had at Amazon were very, very different. We were very comfortable taking billion-dollar bets on the next iteration of Moore's Law. Did not sneeze at that. But if we're going to do a different type of innovation, we like kind of broke out in hives. It was hard for us to do. And then we wanted to, because Intel's mantra was, you know, perfect and repeat. And that's how you can develop, wafers at scale. Well, when you're starting a brand new business, maybe in a market that doesn't even exist, there's not those processes and those certainties that need to be addressed. So that was hard for the company to understand. And over time, through doing some of the things we talked about today, the company felt more comfortable with innovating outside the core and got better at that, which was great. By contrast, I get over to Amazon, and Amazon, somebody once described it as like a thundering herd of competing animals, that there was just a lot of things happening. When I was there, we would announce at reInvent every year how many new things we launched. And it was off, it was in the multiple hundreds. And at Amazon, again, if you go through that process of working backwards, writing that press release, the company was very willing to give almost anyone who would go through that process resources to build. But it was all about customer obsession and move fast. So there, we got resources to do things, but we had to get things in the market within a year. And when we got it, because we needed customer feedback, we didn't want to do a pricing study. We didn't want to do just focus groups. We wanted to say, here's something we built for customers. Will you use this? And using it was more important than would you pay for it? Because we figured out we could figure out the economics around it later. Again, this is outside of healthcare. We'll figure out the economics of it later. But if we can develop something that delights a customer, then that's something we would double down on. But we didn't want to be 4 years into innovation before getting in front of the customer, because by then we've spent a ton of money, the market might have shifted, other priorities might have popped up. So speed and agility to get into market and then being agile in market was really, really important. And that, again, is something at ECG we have done as well. We've just looked to really be very fast and innovative in terms of getting things in market and then either driving forward in that or pivoting if needed be, or stopping if need be, based upon what we're learning. So I think that's a valuable way for organizations that might be a little shy, like, I don't want to spend a lot of money on this. You can get things in market fast, especially today with today's tools, and especially in the AI space as well.
Yeah, it's really interesting to think about two different companies. Both have a culture of innovation, but just the way they approach it just way different. It's really interesting to think about.
Yeah,
I think there's something really interesting there to unpackage and talk about within these interviews. It's great.
no doubt. Yeah.
Yeah,
Well,
awesome.
this has been delightful. I've really enjoyed this conversation.
So to learn more, go to the Bright Idea blog. We'll be posting this interview along with other interviews in the same vein, and we're going to have a report coming out based on hackathons and a survey that we sent out. So we're really excited to get that out. Yeah, check out our YouTube channel, check out our blog for this interview and all the other ones. Really excited to get the information out of everything we're learning here. How about you, Mark? Anything you want to share?
Sure. Yeah. To learn more about the innovation and the work that we're doing at Electronic Caregiver, please visit our website, www.electroniccaregiver.com. And for more about some of the stuff that I've been working on and some thought leadership, feel free to follow me on LinkedIn at Mark R. Francis.
Mark, thank you so much for taking the time to chat with us today. I learned a lot. I think it was a really awesome conversation, and I'm really happy that we were able to connect. So thank you again.
My pleasure, Morgan. It's been a mutual pleasure. I learned a lot myself as well, and I look forward to more.